A lot of people have been trying to learn more about the medical ailment that Justin Bieber has after the singer released a video showing his face is partially paralyzed.
Ramsay Hunt syndrome, and it is from this virus that attacks the nerve in my ear and my facial nerves.
Bieber shocked fans by abruptly canceling a Toronto concert on Wednesday. He revealed his condition on Instagram 2 days later. Ramsay Hunt syndrome can cause severe ear pain, even hearing loss. Well, here to shed some light on this is Dr. Matthew Burke, a neurologist at Sunnybrook Health Science Centre in Toronto. And Dr. Burke, let me start with the simplest question. What is Ramsay Hunt syndrome?
Thanks, Ian. So obviously, excellent question here. So Ramsay Hunt syndrome is caused by the reactivation of the varicella zoster virus. This is the same virus that causes chickenpox, and basically it lays dormant in the nervous system, and then at times, rarely, it can reactivate. And in the Ramsay Hunt syndrome, it reactivates and causes irritation and inflammation of the facial nerve that causes some of the dramatic things we've been seeing with regards to facial paralysis and other symptoms.
You said rarely. How rare is this syndrome?
Yeah, it is quite rare. Estimates in the U.S. suggest it's 5 to 10 per 100,000 people per year. So it is really quite rare.
How serious can this syndrome be?
Yeah, so it's variable. It really varies patient to patient. The majority of patients, if treated quickly, usually considered quickly within the first 3 days since symptom onset, the majority of those patients can have a full recovery, at least suggested by a large previous retrospective study. But it really is variable. In some patients, that could take weeks, it could take months, and in some patients, they might not fully recover, and it really could be a long run.
So with that relatively small window before getting treatment, what should, as rare as this is, what should people know about seeking treatment if they start noticing the kind of symptoms that Justin Bieber showed in his video?
Yeah, so obviously if you have, acute onset new neurological symptoms, you need to present to the emergency department for evaluation quickly. Obviously something like facial paralysis is severe. I'm not sure if he also presented with ear pain and kind of blistering lesions in the ear. But whenever you have a new neurological deficit, it's always better to get it checked out. And then usually the treatment would begin in the emerge, which is typically antiviral agents as well as anti-inflammatory agents through steroids like prednisone.
Yeah, and facial paralysis, of course, can be a symptom of a lot of things, including strokes. Yes. And again, the thing is to get to the emerge, as you say, as quickly as possible. Listen, I've read a lot of speculation on social media, which, often isn't worth very much, but I do want to ask you, speculation linking Ramsay Hunt syndrome with COVID vaccines. Is there any merit to that?
So, at this point in time, it's hard to draw any strong conclusion, that's for sure. You'll see a few cases reported in the literature, but certainly no definitive or strong associations that have been seen. The broader umbrella and related conditions like Bell's palsy, there have been definitely a few cases, but to suggest that this would be caused by the COVID vaccine, I think would be certainly a bit of a stretch at this point. But obviously this is a complicated topic.
Well, and part of the theory in some of these posts is that there has been a spike in cases of Ramsay Hunt syndrome, at least in your practice at your hospital. Have you seen any noticeable increase in cases?
Not really. Against, I meet with my colleagues in neurology on a weekly basis. There haven't been any discussions of surges of, Ramsay Hunt cases. And, sometimes these patients are seen just directly in the emerge, and I haven't, spoken with my emerge colleagues, but definitely nothing to report from me or my colleagues in neurology that I'm aware of.
You are cautious in your analysis and you're complete. And Dr. Burke, we really appreciate it.
My pleasure. Thank you so much for having me.